I'm going to talk about some important research that was done in the United States that was published in 2011. And it was really for the first time hearing, or the field of audiology was involved in a major study of aging which was across multiple disciplines. Audiology traditionally, it's been its own weird little profession that's kind of tucked away in the corner of hospitals and not always integrated enough into, I guess, the broader aspects of aging and what we can do about aging specifically. So this 2011 study was done at Johns Hopkins University, multi-million-dollar study, and it was a longitudinal study, meaning that it went over a long period of time, in this case 12 years. There were 600 people in this study. Part of the selection criteria was that none of these people had dementia at the beginning, and they're all aged around the age of 60, and over that 12-year period, they're aging right through to about the age of 72. Hearing was just a very small part of what they were looking at. They were looking at several aspects of many aspects that were known to be associated with aging. Mountbatten baldness, the kind of fungus that grows as you get old. Hearing was just a very small part of what they were looking at, because we know that we have an aging population and there's a whole host of chronic health issues that come with that, and they're all growing, right, as our population grows. So it's of supreme interest to public health officials, universities, the medical community, society at large. What do we do about our aging population? So understanding the effects of aging is really important. So in this particular study, huge amounts of data put together, and at the very end, the most stunning and outstanding conclusion or finding was the very clear links between untreated hearing loss and dementia. What they found was that people with a mild hearing loss, so a mild hearing loss is roughly a 25% hearing loss. When I graduated from university about 20 years ago, we didn't really bother so much about mild hearing loss. We are quite concerned about it in this day and age, given what we now know. They found that people with a mild hearing loss were twice as likely to have developed dementia during the study period relative to their normal hearing peers. They also found that those with a moderate hearing loss, so moderate hearing loss, most of my patients have a moderate hearing loss. It's between about a 25 to 40% hearing loss. Those people are 3 times more likely to have developed dementia during that 12-year period relative to their normal hearing peers. And those that had a severe hearing loss, those very people that I mentioned at the beginning that had left treating their hearing loss too late for us to get a good outcome, those people were 5 times more likely to have developed dementia during that 12-year period relative to their same age peers with normal hearing. So these are quite astounding findings, and they got onto the front cover of the New York Times, got quite a bit of press coverage over in the United States, not a whole lot of coverage here in Australia. However, I must say that this important topic of the links between untreated hearing loss and cognitive decline are starting to gain traction here, and we're getting more awareness about this here in Australia. You may have seen some things in the media. It's just one of the reasons why I do these presentations, because these messages are really important, but I wouldn't say that they're anywhere near common knowledge, right?